G'day everyone, I hope everyone is having a fantastic week. And as you can see here, I'm talking about elbow and wrist pain today. So in this discussion, I'll be talking about two of the most common injuries that I'll see with golfers in particular. And quite a number of you have developed or have had issues in the past around the elbows. So I'll discuss what we call golfer's elbow, and then we'll discuss tennis elbow. Of the two, tennis elbow is the more common one, which is funny, right? What I'll basically talk about is why typically these injuries occur. I'll talk about ways to manage it, some other things that you can do straight away which will help with your pain. And if you have any questions, leave it in the chat below or send me a message personally and I'll get back to it as soon as possible. So let's talk about golfer's elbow first and what it actually is. So golfer's elbow is what we call medial epicondylitis. So excuse the long term, but essentially is the inflammation around this medial epicondyle, which is on this part of the elbow. So what we have here is a number of muscles that run between the wrist and the elbow that do this action. So flex the wrist. And that's what we call it a wrist flexor injury. So with a lot of golfers, this is quite common on your dominant hand. So if you're a right-hander, it's typically on the right arm. It's not always the case. But what we see a lot as physios is when we're releasing the club with our dominant hand, the wrist is going into flexion. So if we keep repeating that action, if there's some sort of weakness, tightness, overuse, whatever reason it may be, this can potentially stir up. And if you've experienced it, you know how painful and uncomfortable it can be. It's like a really sharp stinging pain if you've ever experienced it before. And in this same area, we have nerve supply, blood supply, which makes it a very sensitive area as well. So that's the first injury we'll discuss. And then we've got on the other side of the wrist. So this is the wrist extensors and commonly referred to as tennis elbow. As you can see here in the image, this person is holding a tennis racket. So if you imagine hitting a backhand with a tennis racket, these muscles in the wrist are trying to resist going into flexion. So the wrist extensor muscles are working in an isometric sense to hold the wrist in that position. So over a long period of time, these muscles here, which attach to the elbow from the hand and wrist, become overworked for some that, again, are lacking strength, movement, or maybe increasing their load too rapidly. So when we apply this to golf, then typically it's the lead arm that experiences these symptoms. As we're trying to go through impact, we're trying to maintain the club in a good position. If you're hitting a fade, for example, you'll find that you'll hold the club off a bit longer, which then presents itself to a bit more of this neutral wrist position through impact. Whereas opposed to someone that's hooking the ball, they'll start to rotate what we call into supination there, which takes the muscles off stress a little bit. So I'll discuss this a little bit later as well, but your swing can also have something to do with this as well. So they're the two injuries. Wrist flexion, the muscles around there that basically get inflamed, we call that golfer's elbow. On the other side, the wrist extensors, that's what we call tennis elbow. So let's talk about a golf swing quickly. So most notoriously is Jordan Spieth here. So this is what we call the famous chicken wing. And so if you experience a chicken wing, it can be frustrating, it can be annoying, but it's not always detrimental. As you can see, Jordan has compensated pretty well over his years with this move. But what we're going to see here is more bend in his lead arm, so the left side. And what that's going to do, it's going to put more stress on this portion of the arm here, where I'm highlighting. And with a lot of better players, that arm will be closer to the side, so you can almost dull out the trauma of hitting the ground with your torso then, your side, whereas Jordan's taking a lot of load through the arm, wrist, and hand. And I know Jordan has a pretty strong golf fitness routine, So I imagine for him, strengthening this left arm is a big portion of what he does. Otherwise, he might be one that experiences this common injury. And what I'll also mention around both of these injuries, there's a lot of things to consider. So I'm just going to rattle them off as I typically see with a lot of clients that experience it. So let's talk about first your practice surface. So hitting off mats is certainly one thing I find can relate to elbow wrist issues. What you'll find is under a mat is typically a concrete surface, right? So as compared to playing at the golf course, you're hitting through the ground, you're getting through the grass, and that blow on the hand and the arm is obviously a lot lower in the sense of trauma. Whereas when you're hitting into a concrete pillar, essentially, that club's going to deflect pretty hard, which means you have to grip harder, which then means these muscles undergo more stress. So it's something I commonly see with people that practice at home, chuck a mat on top of their concrete tiles, or whatever it may be. That can certainly have more of an effect. So please practice off grass if it is available to you, certainly. And if you don't, you're going to need to work a bit harder on your wrist strength and movement. Secondly, technically, like I mentioned before, the chicken wing's one thing that we commonly see. Then secondly is the lack of lead rotation in the hip here. So a lot of clients that I see sometimes get into this chicken wing position because their left hip doesn't move out of the way. So instead of that hip clearing and your arms following, sometimes that hip can stop, then the arms have nowhere to go. So instead of going into this straight line around the body, they start to go into this flex position where the elbow starts to bend, which exposes these muscles on the outside of the arm here. Going on from there, grip pressure is another big one as well. So obviously, if you're gripping onto the club really tight, that requires muscle activation. The more that you're activating these muscles, obviously the harder they need to work. The harder they need to work gives you potential for overuse. So when it comes to grip pressure, a lot of professionals tend to go with a 6 to 8 out of 10 grip pressure, typically on that lower side of that scale. If you're gripping onto the club 10 out of 10 all of the time, then these muscles are going to be working pretty hard for you. So I'd certainly recommend that you try and decrease the grip pressure. Some other things to consider is your golf grips. If you're using a really old grip that's very thin as well and isn't grippy, so if it's starting to lose the tack, then that's another thing as well, because firstly, if the grip is very fine, that deflection of the shaft into your hand is going to be higher. And then again, if that grip isn't quite there, if it's getting old and losing its tackiness, that club's going to want to slide out of your hands. So subconsciously, you're going to grip harder to maintain that club. So there's some things to consider if you're experiencing pain around the arm, wrist, and hand. Again, any questions with that, please put it into the chat. So let's now go across here. Excuse all of my background folders and files. I'm just going to scroll to this next study here. So this study is physiotherapy treatment of lateral epicondylitis, a systematic review. So we've discussed this in the past. So a systematic review is basically where they collate research from a number of different articles to make some statements and to help consumers of the articles, so someone like me, help you with your management. So in this article here, we've got it highlighted. So the conclusions are manual therapy and eccentric strength exercises are the two therapeutic treatments, that have the greatest beneficial effects. So with this being said, a lot of you are doing wrist exercises in your rehab programs or in your physiotherapy programs to keep the strength in the wrist. Eccentric training basically means the lowering phase. So if we're doing a wrist curl in this position, the eccentric will be the down phase. And what that does, it puts the muscle under a lot of stress. So when you're doing your exercises, it's a great idea to do it in a slow, controlled fashion. if you're just going up and down through the movement, you're actually decreasing the time under tension. And when we're strength training, time under tension is a good thing, because what this is doing, it's giving us more volume, it's giving us harder work to do, so that when you go back to the golf course, you can then put up with all these stresses that you're getting through the golf swing. So it's really important to note that. Some other evidence here, it's got shockwave therapy, bandages, kinesiotaping, and wrist bracing isn't mentioned here, but I'll get to that in a little bit. So these are some other things that you can potentially try at your local physio if need be. If you're after taping techniques, you can go to my Instagram, and there's a tennis elbow bracing technique where essentially you just wrap rigid tape or kinesio tape around the forearm where you're getting pain. Very easy taping technique, and that can actually help prevent some symptoms as well. So shoot me a message if you want the link to that as well. So with that being said, let's move across to elbow bracing. So this study is tennis elbow brace and wrist cock up splint in the management of tennis elbow, a comparative study. So what we have here, pardon me, I'll just go to the conclusion. So significant symptomatic relief can be achieved in patients with tennis elbow by using either the tennis forearm brace or the wrist extension splint. So let's just talk about the brace, because that's something that you can use in your golf game today or tomorrow. So what that is, it's basically a strap that goes around the muscles on the forearm so that we can support the structures there. And it works potentially in a number of ways. We don't actually know. So the, theories behind it is, one, the muscles are basically compressed closer together. So this makes them in a mechanical position to work better. If the muscles are further apart, if we imagine doing a bicep curl, if my arm's outstretched, it's harder to activate the muscle. If the muscles closer together, or in this position, are much stronger. So that's the same concept when it comes to this bracing. Secondly, it can almost confuse the brain because we've got a pressure over the pain site. The pain signals aren't traveling, they're getting confused in a good way, so it can dull out some of the symptoms. So this is really important when it comes to playing golf. If you've got a big event on, you can't take a day off, or you want to just push through the pain because you want to play with your friends or your buddies, then using a brace is a great idea. What I will mention with this, please don't wear the brace 24/7. Please don't sleep in it. Please don't wear it if you're at your desk or you're walking around the house. Only use it when you're doing labor-intensive work, when you're playing golf, when you're training. Because if you're using it all the time, it's going to mitigate the effects, and it's not going to be as useful for you when you're playing your golf. So only use it when you really need to. It's like a last resort, in my opinion. The big things that are going to change you for the long term are going to be addressing the strength issues, movement issues, potentially swing mechanics, managing your training load, looking at the training surfaces that you're working on. They're the big rocks in the jar. Using a wrist brace, getting a massage, getting taping on the wrist, these are all short-term things. So obviously a lot of you are very motivated to improve your health and fitness, so you're already really well invested in the long term. So I don't believe any of you are just going to slap a brace on and do nothing else, but I thought that was important to mention. So this is another study. This one here is called The Immediate Effects of Orthoses on Pain in People with Lateral Epicondylgia. Very long words, aren't they, in medical jargon? I hated learning these at university, just for a side note. But aside from that, very similar to the last study. Reported pain for the orthosis was lower than that of the placebo. So pain was reduced significantly with the counterforce brace. So let me just show you what a suitable brace would look like. And there are hundreds. So I'll just type into Google here and I'll find the first one that comes up that I think's suitable. So let's go tennis elbow strap. Images. So like I mentioned, I've seen hundreds there's a lot of good ones and a lot of bad ones. So my advice is pick something that's very small and comfortable. So this one here, you can see how it's small, it's not going to restrict your movement, and it's going to target the site where your symptoms are. This is obviously targeting the tennis elbow symptoms. You can flip it around and then target the forearm, so the other side of the arm, and it's going to work in a pretty similar effect. I find if you get one that's really big and bulky, that's going to limit your movement, it's going to be uncomfortable, you won't want to wear it, and I don't find it dulls out the symptoms as much. So if I slide across to this here, it's basically a sleeve. So it's not very targeted, it's not going to be comfortable, and it's not going to give you the same effects. And this is after working with clients for years, them coming to my clinic and them just not getting good results from them. They're typically more expensive as well. So you could go to your local chemist tomorrow, and I'm sure you'd get something like this or something like that, which is much better value for money. So let's now look at a very important topic. I've been talking to a couple of clients about this in the last couple of weeks, and this is called the acute chronic workload ratio. Again, long words. It's going to give me anxiety about stuttering if I keep on talking about these medical terms, that's for sure. So what we're talking about is, what is your load, your exercise load in the last week compared to the last month? And then we basically create a ratio. So essentially, if your ratio is 1, you're doing exactly the same thing in the last week compared to the last month, week on week. If you then start to creep your exercise up, let's say for example you add another practice session in, or you add another gym session in, or you add in a run around the block, this is then going to push us up in this direction. So let's say for me, for example, I typically play golf once a week to once a fortnight. If I then go to playing twice a week, I'm essentially doubling my ratio. And all of a sudden, I put myself in this danger zone, which is a huge injury risk. So when we relay back to these wrist issues now, if you've got a tournament coming up, if you have a member guest coming up, if you have whatever it may be, if you're increasing your workload rapidly, your body doesn't get a chance to adapt to this. So then all of a sudden, these aches and pains might start to come around as a red flag, right? Your body starts to say, whoa, I haven't done this in a long period of time. I'm not used to this. I'm going to start freaking out. I'm putting the alarm bells on, because that's what your body's very good at doing. It's very good at protecting yourself. So when it comes back to our strength training and our physical training, we want to really work hard in the gym to make sure that when we go to the course or other hobbies, we can tolerate that. So it's just really important to know what you're doing week on week, and I'd encourage a lot of you to keep a journal or keep a strong mental note of what you're doing week on week. And if you... sorry. That is my alarm to stop talking so much. But if you're really rapidly increasing your load, then you need to keep this in mind. So I thought that was also important to note. But that is the end of this week's seminar or tutorial or talk, or however you'd like to think about it. But let me know if you have any questions with it. It's, again, one of the things that I see quite a lot in the clinic. I think it's very avoidable, but in short, monitor your practice load. Make sure that you're getting stronger in the forearms and wrists. Make sure you're practicing off softer surfaces where possible. Regrip your clubs if you've got some older, soft grips that are wearing out, and make sure that you feel your technique is in an efficient spot. If you want to get your swing reviewed, send me that personally, and I'll put it through Sportsbox and give you a 3D analysis of that, and I'll let you know if I have any concerns. But I think these are some important notes to make. I appreciate your time, and I look forward to speaking to you all soon. Thanks.